As a continuation to the topic appendicular skeleton, first we have studied the main two first parts, which are pectoral girdle and upper limb. Now, in continuation to this, the remaining two parts, which are pelvic girdle and lower limb. The pelvic girdle is the hip girdle and the lower limb refers to the legs. Pelvic girdle, which is also called as hip girdles. What bones constitute the pelvic girdle? Two coxal, that is hip bones. We can also call them as innominate bones. Each bone is divided into three major parts. Ilium, which is the uppermost part, ischium, which is the central part, and pubis, which is the lowest part. So two hip bones will comprise of ilium, ischium, and the lower part, which is called as pubis. Sacroiliac joints, that means that joint or those joints which will unite together. Sacrum, which is a bone, as we have seen in the vertebral column, a bone which is formed by combination of 5 sacral vertebrae. Iliac, because it joins the ilium as well. Pubis symphysis, that point where both these pubis they join and slight movement is possible between them. So that joint is pubis symphysis. Function, what role they play? Support for vertebral column, that is backbone. Protect the pelvic organs, that means those organs which are present in the pelvic cavity, and attach the lower limbs. So basically a hip girdle is made up of two bones which are called as hip bones. Coxal bone markings, the outermost one ilium, ischium, pubis, acetabulum. This cavity is acetabulum, which is analogous to that of glenoid cavity, which we have studied earlier in case of scapula. Scapula, if you remember, a part of the axial, a part basically of the pectoral girdle only, but that component which has a cavity called glenoid cavity into which the humerus, the bone of the arm, will attach. Similarly, here we have acetabulum into which the bone of the lower limb, that is femur, will attach. So acetabulum, iliac crest is the outer layer of the ilium, and finally a large opening which is called as obturator foramen. So upper part ilium, middle part ischium, lower part pubis, acetabulum, the cavity into which the first bone of lower limb, that is femur, will get attached. Iliac crest is outer layer, and obturator foramen, a large opening in the bone for the passage of nerves and muscles. Pelvis, a cavity which is created by the association between two pelvic bones, that is two hip bones. A combination of the sacrum, coccyx, which is the tailbone, and the two hip bones. It is divided into two major parts: greater pelvis or the false pelvis, which is an empty cavity present towards the upper side; lesser or true pelvis, which is again an empty cavity called pelvis, but it is present towards the lower side. So greater or false pelvis is at the upper, and lesser or true pelvis is at the lower end. If you magnify a single hip bone, this is a prominent way it is seen. Iliac crest is outer layer, ilium uppermost part, ischium middle part, and pubis the lower one. So this, as we saw, was acetabulum into which femur gets attached, and this one is obturator foramen, a large opening from which muscles, blood vessels, nerves will pass. Comparison of male and female pelvis. Suppose if we have a skeleton which is buried underground long back, and on its removal we need to identify whether that person when alive was a male or a female. We can easily differentiate, we can easily distinguish between like what is a male and what is a female skeleton on the basis of these pelvic bones. What is the difference that marks it as a male or a female? General structure. In case of female body, the bones are light in weight and they are very thin. In case of male body, they are heavy and thicker because of the more bone density which a male body has. False pelvis. In female, it is very shallow, but in male, it is deep within. Pelvic inlet, that point at which pelvis starts. In female, it is larger in size and it is oval in shape. Oval, much like an egg. In male body, it is smaller and it is roughly heart shaped. Acetabulum, the cavity into which head of the femur fits. Female body has small and it faces anteriorly, that is, it faces towards the front. In male body, it is large and it faces laterally, that is towards the side. Obturator foramen, the large opening which is present at the bottom of the hip bone. In female body, it is oval, and in male body, again, it is round. Pubic arc greater than 90 degree. The reason is so that the pelvis can widen during the time of parturition, that is childbirth, because the female pelvic bones have to retain uterus within them and it has to contract for the sake of parturition. Therefore, it has a wider angle to accommodate more of the female reproductive organs into this pelvic region. So the angle is greater than 90 degree, that is, it is a very wide obtuse angle. For male body, it is less than 90 degree for the main anatomical landmark of females being able to give birth. So for the general structure, females have a light and thin component bone, males have heavier and thicker bones. False pelvis in females is very shallow. For male, it is deep. Pelvic inlet for female is larger and oval, while in male it is smaller and it has roughly heart shape. Acetabulum, which attaches itself to femur, female has small and it faces anteriorly, while in male body this cavity is large and it faces laterally, that is towards the side. Obturator foramen, again for female body, it is oval, much similar to the pelvic inlet. In case of male body, it is round. The pubic arc for female body is wider for the sake of being able to give birth, and male body it is narrow, less than 90 degree. Now moving towards the lower limb, similar to upper limb, our lower limb is also made of 60 bones, 30 in each lower limb. The division goes as femur, which is the very first bone, which forms the thigh region. Patella, which forms the knee, the small triangular bone, roughly spherically triangular bone, which is present in the knee. Tibia and fibula, which are the bones neighboring to each other, adjacent to each other, much like radius and ulna, which we saw in the upper limb. Tarsals, which are analogous to carpals, which we saw in the upper limb. Metatarsals, which are analogous to metacarpals, and finally phalanges. So these bones go as femur, 1, patella, 1, tibia, 1, fibula, 1. Tibia and fibula are adjacent to each other. Tarsals are 7 in number, unlike carpals which were 8. Metatarsals, they are 5 in number, similar to metacarpals which were 5. Phalanges are 14, similar to phalanges in the upper limb. Talking about the first bone, which is femur, longest, strongest, heaviest bone in the body, not only the lower leg, not only the lower limb or leg, it is the strongest bone of the whole body. Diaphysis has a medial bend, it is slightly curved to bring knees closer to the midline of the body. As we can see the shape, it has a very prominent round outward projecting head. The greater trochanter which arises out. This constricted narrow part is a neck which connects the head to the remaining part of the body, which can also be called as shaft. Lesser trochanter, a lesser protuberance. Shaft, which is the main body of the bone. Lateral patellar surface and medial condyle. Lateral condyle, the one which is towards the side. Medial condyle, which is towards the middle. And patellar surface is the region which will help in supporting the patella, which is the knee bone. Continuation of femur. Each femur is divided into head, this region, neck, the narrow part, trochanters, greater and lesser, 2 in number, condyles, the lower ones, and patellar surface, that surface which beholds the patella or the knee bone. Patella, a sesamoid bone. Now, what is a sesamoid bone? That bone which arises from a muscle tendon is called as patella. So, sesamoid bone develops in the tendon of the quadriceps femoris muscles, those muscles which are attached to the femur bone, maintains the position of the tendon. It doesn't allow it to move. Tibia, shin bone, larger of two lower leg bones. We have two tibia and fibula. So tibia is the larger one. Articulates with femur at the top, fibula at the side, and talus is a bone of the metatarsal part. Tibia continued, condyle, tibial tuberosity, and medial malleolus. Fibula, a very, as its name goes, feeble, very weak bone. Parallel and lateral to the tibia, articulates with the tibia and the talus. Head, lateral malleolus. So this is the upper part called as lateral condyle. A very small rounded head, a long slender bone and a lateral malleolus which projects outward. Your foot region consists of 7 tarsals, 5 metatarsals, and finally 14 phalanges. Tarsals, 7 ankle bones. Now, ankle is to the feet what elbow or rather wrist region was prominently to the upper limb. So there we had 8 carpals in the wrist, but here we have 7 tarsals. One is compensated for patella. We don't have any other separate bone similar to patella which is present in the knee. So we don't have any such bone in the upper limb. So to compensate for that number, one patella we have here extra and one tarsal less if we compare it to the 8 carpals of the upper limb. So 7 ankle bones. Posteriorly we have talus, calcaneus. Anteriorly, we have cuboid, navicular, and 3 cuneiform. So, 1 talus, 1 calcaneus, 1 cuboid, 1 navicular, and 3 cuneiform. This will give you total 7 ankle bones. Metatarsals, these 5 bones. 5 bones make up the instep of the foot, numbered as 1 to 5. Phalanges are similar to the upper limb, 14 in each foot. Hallux or big toe, greater toe, the thumb of the foot is called as big toe. It has 2, and the rest of the toes, which are analogous to the fingers of the hand, they have 3. So finally, the division of the pelvic girdle goes as pelvic girdle is made of 2 hip bones. Then the lower limb constitutes of 60 bones, 30 in each leg, divided as 1 femur, 1 patella, 1 tibia, 1 fibula, 7 tarsals, 5 metatarsals, and finally 14 phalanges. This brings to an end regarding the topic skeleton.